thyroid is a gland located at the base of your neck near your larynx. The thyroid is butterfly-shaped with two lobes that are joined by a thin strip of tissue called the isthmus. The thyroid is an endocrine gland, which means that it secretes hormones. It is part of your endocrine system, and it uses iodine from the food you eat to produce hormones that regulate many aspects of your metabolism, including your heart rate and how quickly you burn calories. These hormones are called triiodothyronine, also known as T3, and thyroxine, also known as T4. The parathyroid glands are also endocrine glands, and they are located behind the thyroid. Although these glands share the same location as the thyroid gland and their names sound similar, do not confuse them. Parathyroid glands produce parathyroid hormone, which helps control the levels of calcium and phosphate in the body. Nerves that control the voice pass close to the thyroid. They are called the laryngeal nerves, and they are located on either side of the larynx. These nerves control the vocal cords and so affect voice quality, pitch, and the ability to speak and sing. And the external branch of the superior laryngeal nerve is important for raising voice pitch. Many lymph nodes are located in your neck region, close to the thyroid. Lymph nodes are small, bean-shaped glands that form part of the immune system. When you have a cold or are fighting an infection, they are often swollen and can be felt just underneath your jaw. Lymph nodes play an important part in your body's ability to fight off infections by filtering fluids in your body and capturing bacteria, viruses, parasites, and other harmful substances. Thyroid nodules are lumps that develop in the thyroid gland tissue. More than 95% of these nodules are benign, not cancerous. Thyroid nodules are a common occurrence in the general population, although they are 3 times more common in women than in men. Around 1 in 3 30-year-old women will have a thyroid nodule, while only 1 in 40 men of a similar age will develop a thyroid nodule. The incidence of thyroid nodules also increases with age. Half of women aged 50 have at least 1 thyroid nodule. A thyroid nodule can be solid thyroid tissue, or a cyst filled with fluid. If there is just one nodule, it is called a solitary nodule. If there is a group of nodules, it is called a multinodular goiter. Most thyroid nodules do not cause any problems or have signs or symptoms. It is possible to develop one without even noticing. Occasionally, however, nodules can become so large that they can be felt or seen, often as a swelling at the base of your neck. There are different types of thyroid nodules. Approximately 95% of thyroid nodules are cold and 5% are hot. These terms do not mean there is a temperature difference. Cold nodules are made of thyroid tissue, which does not produce any hormones, whereas hot nodules are made of tissue which does produce hormones. Hot nodules usually produce too many thyroid hormones. This affects the body's metabolism, interfering with processes like heart rate and temperature. When a nodule is found, it is important to clarify whether it is benign or cancerous. Only a small minority of thyroid nodules will be cancerous, malignant. Thyroid cancer is a rare type of cancer that affects the thyroid gland. It is usually treatable, and so you may hear it described as having a good prognosis. In most cases, it is cured completely after the initial treatment. Do not be frightened by the word cancer. Although it is a cancer, it is rarely fatal, and very few people die of thyroid cancer. This is because the disease usually develops very slowly, and because the treatments available are very effective. There are 4 main types of thyroid cancer. Papillary carcinoma is the most common type, accounting for about 8 out of 10 cases. It usually affects people under 40 years old, particularly women. Follicular carcinoma accounts for about 1 out of 10 cases. It tends to affect middle-aged adults, particularly women. Medullary thyroid carcinoma accounts for less than 1 in 10 cases. Anaplastic thyroid carcinoma is the rarest and most serious type. It accounts for around 1 in 50 cases and usually affects people over the age of 60 years. Papillary and follicular carcinomas are sometimes known as differentiated thyroid cancers. They tend to grow and spread more slowly than other types of thyroid cancers, and this means that they are easier to treat.